Cases of syphilis are on the rise in the United States, from fewer than 6,000 cases in 2000 to more than 207,000 in 2022. It's also increasing among women who are pregnant. 13 on your side's Elena Holland tells us why that's a problem.
The rate of syphilis in American mothers has more than tripled from 2016 to 2022, a constant increase doctors have been seeing continue.
And that's amounted to a seven-fold increase. So for every one person that was infected in 2012, we see 7 infections in 2022. And that's a staggering number for a disease that is largely preventable, that is largely treatable.
Dr. Mike Chamise is a maternal-fetal medicine doctor with Corewell Health.
Residents of West Michigan, I don't think that we're any more immune to this than anyone else.
Dr. Chamise says syphilis can cause an increased danger to pregnant mothers because the infection can be transferred to the baby. The early points of infection poses the highest risk to the fetus.
You could see higher rates of stillbirth. You can see higher rates of potentially poor outcomes. Preterm labor can be an issue. And even after delivery, those neonates can also have a higher morbidity and they can pass away.
Syphilis has been around as a sexually transmitted infection for centuries.
Syphilis was a huge issue with respect to surging infections, and it was a sexually transmitted infection, but it took many years to get to a point where we understood what transmitted it, how it was transmitted.
Since the 1940s, there has been a great reduction with the discovery of penicillin. There was a spike in the 1980s with the HIV epidemic, but eventually leveled out until now. Dr. Chamise said one of the big reasons is a lack of access to health care.
Pregnancy might be one of the first moments that a mother may have, become or, sort of use the healthcare system.
Syphilis is a mandated test for any mother who begins prenatal care, but without health care, that could be skipped.
The symptoms can be so minor, so nonspecific that you may not even have a thought that you may have a sexually transmitted infection that is very treatable.
He says it is never a bad idea to get tested if you suspect an STI. The treatment, he says, is available and effective.
It shouldn't be something that we should see a resurgence of. We definitely should. And I think we need to keep up our advocacy and our education and make sure that everyone's adequately treated with the appropriate regimen.
Elena, if syphilis can transfer to the fetus, does that also mean it can transfer to the baby once it's born?
Yeah, Julia, in 2022, there were 3,755 cases of newborns born with syphilis. That's an increase of 183% since 2018. Julia.
Elena, thank you.